So I'll give a very quick readout of the semi-plenary that dealt with some of the enablers. As moderator, I get the prerogative to kind of filter the messages based on what I heard and what I liked. So Carolyn Hike spoke about data, particularly from EMRs. One of the key messages that I heard was really aligning those extractions and needs for data to clinical programs, very much like what we heard last night with the Own the Podium conversation, where we really need to have laser focus, manage the scope, and really focus on the ROI associated with that data. Stanley Radichak from Infoway spoke about privacy. One of the things that our privacy group at Infoway did was an environmental scan, and no surprise to anyone, we heard it yesterday as well, there's a lot of variation in approaches and maturity with respect to privacy and the secondary use of data. But the good news is we've published a common understandings paper in that area where we've brought together all of the jurisdictions and really helped them develop a set of understandings that can be applied in a similar way or a consistent way across the country to help reduce some of those variations. I assume the challenge will be on the implementation side now that we have them written down. Kimberly Navala from SAS spoke about some of the enabling tools to support analytics. I liked one of her comments about using analytics to drive the business, but more importantly, to really know the customer. How do you do it in the context of a clinician and knowing who that end user is versus an administrator and what their needs are? And the consumer as well. Their needs would be very different than those of a clinician or an administrator. The point she made was applying those results back to the end user in a personalized way. The other thing she proposed is really think about a portfolio of analytics and a roadmap with an ROI and a very clear understanding of the value creation, and then focusing on the data needs to support that value creation and obviously supported by the ROI. And then last but not least, we had Jeff Ruby, founder and CEO of a wellness platform called Newtopia. If you're not familiar with Newtopia, it's largely focused on risk assessments in a very personalized way, using information from the person, personalized information, genetic information, as well as behavioral information to deliver a personalized experience, also with the support of a coach, and also with some gaming approaches as well. A lot of data coming from a lot of sources, a lot of it being analyzed in real time, but with a very positive ROI. Their experience with one insurer in the US is driving down the healthcare costs to the tune of $1,500 per person, so a very good story there. Brent?
Thanks, Dennis. So in track 2, we had both a panel and an audience passionately interested in methodologies, algorithms, microsimulation, etc. It was a fascinating discussion, but when we were challenged by the time we had to talk about the issue, I think we could have went on with the Q&A for quite a while. But really what we saw there through the various presentations was examples of tools transforming data into usable information to support patient care at the practice level, to support planning and management at the provincial and system level, and also looking to the population level and thinking about overall trajectories, disease burden, costs of the system. Doing these in pursuit of many things, to profile and understand populations and individuals, to study past trajectories, both of disease and also care pathways. But perhaps most importantly, and what we're really when we look to the future, it's about opportunities to predict and alter future outcomes, whether they be around disease burden, costs of care, or other aspects. What was particularly interesting, I think, was as it turned to the Q&A, the questions weren't about, tell me about the details of this particular tool. It was about really thinking about sort of the bigger picture about what's needed in the future and the applications of the tools. So certainly a recognition that applying these tools to particular policy or system questions or questions of the care of individuals is really important. Several comments around the importance of EMR data in our ability to scale and spread these tools and make them even more useful. A comment made very appropriately, which was, why isn't EMR data more like acute care or emergency department data, or now long-term care data, in terms of its consistency, its standardization, and its availability for provision of care and system uses. Some discussion as well about the importance of interoperability for care and service response. So having that, those very important pieces of information, clinical information about the person that's sitting in front of you as a clinician who has seen other providers in other settings and is now there in front of you. And there was a good example yesterday with Paul Hebert saying, this is basically all I know about a patient when I first see them. So that being really important, and that data is getting into the hands of clinicians closer to real time for care provision. And even when we look at the comparative data about a particular, how is my practice compared to other practices, that it be in fact closer to more timely than it is today. Also, as we sort of broaden out to the system and the population level, we saw some examples of applying the concept of segmentation that we might know from other contexts to populations in terms of their needs for care and how they're managed in the system. So supporting policy and planning, resource allocation, et cetera. There was also a bit of a thread around the need for more standardization in these tools and the importance that the algorithms and tools be non-proprietary, because certainly understanding the inner workings of how things are measured and how variables are derived, if you will, is critically important. And of course, the underpinning of all of this was improved accessibility to data, and most importantly, the importance and value of data linkage to make this all work. So it was a really interesting session, and if you want to know more, you can watch the videos.
Excellent. So session number 3 was in this room on dashboards and decision support, and we started off with what Stefan, I think, quite appropriately called the speed dating portion of our panel, where each of our 5 panelists presented some quite different tools that they've been involved with using, everything from point of care decision support through to tools used by patients, regional indicators, local community information around population health, and information and tools used at the policy level to help drive decisions and drive action around improved prescribing, all the way up to the international comparisons as well. So we had quite a variety of things presented. And that led us to a series of, I think, quite thought-provoking questions and discussion around these kinds of tools. Everything from, so if we're benchmarking ourselves versus the rest of Canada, are we benchmarking ourselves against excellence? And what's the implication of that in terms of how we're driving health system performance? Are we measurement rich but action light? And how do we make sure that there's a receiver capacity? How do we make sure we're starting by understanding what is the change that we're hoping to see, and looking at the changes in culture, the changes in management, the changes in accountabilities, in resources and structures that would allow you to drive that through all the way to results. And we heard about some great examples of where that's happened, but also I think an appetite to see that happen more. We also heard about some of the challenges in terms of presenting information, how people are accessing that information, and how you convert that into quality improvement, and when do you link up with other groups, whether that's colleges, regulatory groups, or indeed groups who are charged with quality improvement initiatives, to be able to draw these threads together and really help to drive change. And last, but certainly not least, we also talked about how do we understand how people are acting and reacting to this data? How do we start really building that strong awareness and understanding that an indicator, information, analytics are both about how to build they're not a sign of defeat, but also about how to predict what you could see and then be able to take the actions that would get us to where we collectively want to be. So my thanks to all of our panelists and everyone in the room for those great discussions along the way.